My name is Dr. Sarah Myhill. I am a conventionally trained medical practitioner and I qualified in 1981. I've always throughout my career been interested in asking the questions why. What are the mechanisms that underlying disease? Why do people get cancer? Why do people get arthritis? Why do people suffer from migraine? And perhaps as a result of that, I've developed interest in patients with chronic fatigue syndrome and with ME, because that is one of the worst treated conditions in medicine today. Post-viral syndromes are common, but we don't have an antiviral for every virus that's present. And this is why we have to rely on the immune system to deal with these viruses. Look after the immune system and that will look after you. Long COVID is just another example of how the immune system has been unable to rise to the occasion to deal with that infection, and therefore it has become chronic in the body. Now, the key thing to remember about long COVID is that it is not a diagnosis, it's a clinical picture. And it's important to ascertain the differences between those things, because a diagnosis implies a mechanism and therefore an obvious treatment. A clinical picture is what it is, it's a clinical picture. And in long COVID, we have two aspects. First of all, we have poor energy delivery mechanisms, and so that person is physically and mentally fatigued. And secondly, we have chronic inflammation, because the body is not dealing effectively with that virus which is persisting in the body. And inflammation symptoms are characterized by pain, red, heat, swelling, and loss of function, and they are very uncomfortable. And when you have those two symptoms together, poor energy delivery mechanisms and inflammation, that clinical picture we call ME, or myalgic encephalitis. And long COVID is another form of myalgic encephalitis. It's simply another microbe that is driving it. So in helping to elucidate the underlying factors, look at what went before that acute infection. And if you have somebody who is, as I call it, an addict and is running their life on addiction, sugar, tea, coffee, caffeine, nicotine, alcohol, and they need that in order to allow themselves to function to their full potential, then you know that energy delivery mechanisms are starting to be impaired at that stage before they even develop their acute COVID. People who are not taking nutritional supplements will inevitably be deficient, because you cannot get the perfect nutrition from a modern diet because of modern farming techniques. People who are allergic or have autoimmune condition, the immune system is already behaving incorrectly. Allergy and autoimmunity occurs when the immune system has been badly programmed and it's reacting to foods, maybe, or pollens, or maybe chemicals that are otherwise benign. So, and of course, autoimmunity is civil war, using the immune system as our standing army. If you've got autoimmune condition, then that is civil war. That's the army fighting self. So those will give you clues as to whether you've got a problem with the immune system or whether you've got a problem with energy delivery mechanisms, and maybe allow you to concentrate your fire on a particular aspect of treatment. But the basic workup to treating these patients is standard and is exactly the same, and we have to work through it in a logical order. This brings us to the treatment of long COVID. And long COVID is ME. And as you now know, there are two aspects of that. First of all, improve energy delivery mechanisms. And secondly, we have to restore immune function, and we have to normalize immune function. And if you've got a good immune system that's working well and with the tools of trade, you will be completely protected from ME or long COVID. So what I'm saying to all my patients, and what you should be saying to all your patients now, is put the immune system in tip-top condition now to prevent long COVID. Don't wait until you get acute COVID and then you get long COVID. So the overall strategy for treating long COVID is to improve the immune defensive with groundhog regimes. I love using this term groundhog because it doesn't imply a specific treatment, it implies a package of treatment. And I call them groundhog regimes because we're coming back to the same stuff over and over and over again. So the starting point to treat dementia or cancer is exactly the same point as the starting point to treat chronic fatigue syndrome or heart disease. The way that groundhog regimes work is we should all be doing groundhog basic all the time. Now, guess what? People don't come to me when they're well. They don't come to me, aged 22 and a half saying, and how do I live forever? How can I live my life to make that happen? Of course, that never happens. But we should be doing Groundhog Basic all the time. And the way we should apply that is we should apply that to our children. And Groundhog Basic is the paleo-ketogenic diet, the basic package of nutritional supplements to compensate for the deficiencies of modern agriculture. Vitamin C, 5 grams daily, because we can't make our own vitamin C and therefore we have to consume it. Vitamin D, 10,000 IU daily, because we don't spend enough time in sunshine. We tend to live indoors and we don't get the ultraviolet light to make our own vitamin D. And then good quality sleep, enough of it. And then get the right amount of exercise and work, rest, balances. That's Groundhog Basic. And then we have what I call Groundhog Acute. And Groundhog Acute, they are the interventions we should put in place at the first hint of any acute infection. And that's because if we don't get rid of that acute infection quickly and efficiently with a fabulous immune system and all we can do to help it, then there is a risk of those microbes making themselves permanently at home in our body. And that is important because much pathology, much heart disease, much cancer, much dementia has an infectious driver. It has an infectious associate. And so if we can prevent these microbes getting into our body in the very first place, then we are going to be so much more likely to lead a long and healthy life. Thank you for joining us today at the College of Naturopathic Medicine. Naturopathic medicine is all about asking the questions why. All those remedies are available in nature. They should be available to all of us. Our job is to give you the power to heal yourself, your family, your friends, and then extend that out to the wider general public. So stick with us, look at the resources we have. The answers are there. It's a case of you finding them and applying them to specific problems. Now, if you're interested in any of these subjects, I have prepared a long COVID webinar that CNMM you can access at the link below, which goes into all these things in very much more detail. So perhaps I'll meet you there again.